You're listening to the Active Mom Podcast with host Dr. Carrie Pagliano. I'm a mom, physical therapist, and your go-to guide for staying active with pelvic health issues in pregnancy, postpartum, perimenopause, and beyond. Whether you're a fellow mom, physical therapist, or women's health professional, join me where I'll share expert insights, real-life stories, and the latest research to help you approach running, CrossFit, yoga, Pilates, HIIT, or whatever activity you love with confidence and evidence-informed guidance. Let's start the show. All right, full disclosure, sometimes I use my podcast as just an excuse to hang out with my internet friends that I've never met in real life. And that's kind of what this episode is. Diving into our new season here, bring back another friend to the podcast, Christina Prevett. She is a physio and researcher and athlete and mom extraordinaire in Canada. And we just she's just a fun person and super smart. You're like the library. You're like the human PubMed, which I totally appreciate about you. And so our purpose of today, if you're tuning in and you haven't chatted or listened with Christina before, is we're just going to talk about some stuff and have some critical thinking conversations instead of just spewing nonsense. We're going to have some good conversation. No controversy whatsoever, right?
Never. I don't say things that just rock the boat sometimes, you know?
Christina, Dr. Christina Prevett. I don't think you had your PhD the last time you were on. Dr. Christina Prevett, welcome back to the show.
Thank you so much. You know, it's funny. I have some of my some of my faculty that I work with over at ICE. They call me the walking encyclopedia, just like you said. It's like, she's like, I feel like you're going to know where this study is. So that's a big compliment because sometimes it's tough to stay on top of the literature, but we're like I just feel like we're just at the top of this boom that is about to happen in research in pelvic health. And it's very, very cool to be a part of it because we have minds that are changing. Our approach to rehab has really taken a shift and it feels slow, but it's really you got to build up to that explosion. And I feel like we're just we're on this edge of it. And so 2024 through 2026, I can just imagine is this wind up to really start seeing some things that are going to change.
And for those that are new to the profession, those that are new to working in pregnancy, postpartum, there's a lot of frustration. Why don't we have this stuff out? And for those of us that have been around for a while, we're finally. But what I so appreciate about you, and I think this is part of the tides turning, and a lot of the people that are involved you are Switzerland in that you can interpret the research appropriately. You can critically analyze it, you can critique it, but you also bring back experience from the clinic and clinical kind of reasoning. And then you also are in the gym or the garage every freaking dang day. And so you have that personal experience too. And I think there's so much value to walking that talk. And I think that's what the turnoff was for so many years, where you just have, and no offense to bench researchers, thank you for your service, but we need to be able to speak all the languages, and you do such a nice job of that.
It's been really interesting. So for individuals who haven't heard my story, I finished my PhD in geriatric rehab, looking at resistance training in transitions in mobility status and looking around independence. And then now my postdoctoral work is on resistance training, specifically high intensity functional training, high intensity resistance training in pregnancy with kind of a special lens on the pelvic floor. And, so much of our research has been done looking at fetal outcomes and delivery outcomes, but not a lot has really focused on mom's musculoskeletal health and how mom is recovering from birth. And so many people think that those are two very different areas, but they both have one very big similarity, which is that we tend to be very conservative and underdose in both of those areas of practice, right? In geriatrics, people have more chronic disease. They have more stuff going on. We have wrinkles on our face. We got wrinkles on our insides. And so it's just, we have stuff going on when we're seeing people who are in their 70s, 80s, 90s, and that makes them more vulnerable, which makes us a little bit more timid. And the same is true in pregnancy, where you got this another tiny human that you're taking care of and all of your systems are changing, and it makes us a bit timid. And so it's been kind of cool to see some of this change, but I always joke that I have my clinician hat And then I have my research hat, and my research hat needs to be informed by the clinician hat, but my clinician hat needs to have the justification of the research hat
Right.
in order for me to have a lot of confidence in what I'm saying. Like, one of the things that just drives me crazy on social media is that people are so confident in some of these things, and I'll push back and I'll say, like, where's your research for this? And then they're saying, like, well, where's your research? I'm like, I'm not the one who's putting it online.
That one
I don't
kills
have to take
me.
money. Like, I have it, but
Like,
also, you're the one who's putting this out, not me.
see the letters after my name, the P and the H and the D, they mean something.
Yeah. I'm like, I do have that, but like, also, this is your reel, not my reel.
I know. Well, I mean, okay, so let's kind of go into the mud right away. And this is again where I so appreciate your opinion, because you have the background and the chops to be able to back all this stuff up. And so, double-edged sword of social media. Yes, there's a lot more information out there. Good news. That's also bad news, because there's more variety of interpretations. I think there's also a tendency of, and we've spoken about this before. There's this weird line between getting information out there that's medically accurate and marketing.
Mm-hmm. Yep.
And sometimes people don't know the difference.
Yeah.
Talk to me about that.
Yeah. So I think that, our attention spans are very short, right? Especially when we're digesting social media. And this happens in research too, where if we're trying to make a statement that applies to everybody, we're going to bias towards more conservative or restricted recommendations, right? Like, if we think about, if I'm trying to make an exercise guideline for every single pregnant person, I'm not going to tell you that you need to lift 75 to 80% of your 1 rep max by the time you're in your third trimester, because one, you don't have those maxes, and two, you don't have the body readiness, even if you weren't pregnant, to do those things, right? And so when people interpret things like our exercise guidelines, right, that is our blanket statement for everybody. Like, everybody would benefit from 150 minutes of aerobic moderate intensity exercise. And everybody would benefit from some amount of strength training 2 times a week, focusing on major muscle groups, hitting at least like a 6 out of 10 intensity in terms of effort to drive changes in strength. Where we have to start being a bit more critical is saying, okay, this person comes into pregnancy as an ultra marathon Ironman runner, and this person comes into pregnancy as a high level power lifter. Like, their body readiness is totally different. And
Right.
so, yes, those exercise guidelines account for them, but this person who's a power lifter is probably going to be able to deadlift 300 pounds for a lot longer in their pregnancy. Our marathon runner might be able to run longer in their pregnancy than a power lifter would feel ready to, because they have a certain amount of conditioning that they have, and their fitness matters coming into their pregnancy. And so we sometimes in social media, we just don't have the space for nuance and, digesting that. And that's where I always kind of push back. And the second thing is that the absence of evidence, it does not infer harm. The absence of evidence does not mean that it is harmful. It means that we don't know. And so with pregnancy and postpartum and pelvic health, if we don't know, the answer is often no. But where I spin and try and reframe that is, in the absence of evidence, I am going to promote health.
Right.
Right. In the absence of evidence, I'm going to promote health, which means that I'm going to, if there's a choice between health promotion and not health promotion and more sedentary behavior, I'm going to try and remove the barrier to get people to health promotion.
Yeah. I think that also, I mean, there's a parallel even just clinically too, because you have providers that are very by the book. You can only do this, you can't do that, like no gray at all. And we were kind of just mentioning before you hopped on about the ability to take that person in front of you and meet the needs that they have. And some of that requires being informed by the literature, but in the absence of it, like you said, like we've got to deal with this person in front of us. And one of the examples I'm thinking of, I forget when this popped up, but it was a while ago, and it even made me think about it a little bit differently. You had posted a video of, I think it was like assisted sit-ups with a monster band. in pregnancy. And I was like, oh, that's cool as shit. Like, of course, wouldn't that be really cool to try? And I've tried it with a bunch of patients. And, we had to have the conversation about, oh, what's that going to do to my abs? And we're like, actually, strengthening is good, and not doing anything is probably not what we want. But there's some people that are really not happy about that and not willing to have that conversation in the gray. So let's dive into that one.
Well, and I don't even think we're in the gray there anymore. So a couple of things. Like, one is, when we didn't have any data, we were looking at like theoretical ideas around how the core changes in pregnancy, right? And so your linea alba lengthens, does not split, it does not separate, it lengthens. Rectus moves in order to make space for baby. This is a beautiful mechanism. And so that lengthened tissue, when rectus contracts, it comes together. In the third trimester, on lengthened tissue, you're going to see some coning and doming. And so Christina of 2020 would have freaked out and said, like, oh, no, time to get away. Like, let's not do that. Right. Christina of 2024, 2025 feels very differently about that. One, I do not freak out about coning at all. I kind of expect it in late stage pregnancy because of the way that the muscles are now situated. Number two is, as I dove into the research, we tend to only look at, especially for abstract reading and not like getting into the meat and potatoes of a study, we are only seeing the things that are statistically significant or positive, and we aren't thinking about the things that are negative. And so Kari Bo's group had a paper that looked at what were some of the risk factors for persistent diastasis recti postpartum, and ab exercise during pregnancy was not a positive predictor. And so that's a negative finding that for me reduced a lot of fear. Reduced a lot of fear for me. And then if I look at our postpartum data and I look, there's certain things that we cannot control, like the size of your baby, if you had twins, if you have any connective tissue, if you tend to be double jointed and your ligaments are a little bit more stretchy than others, like those are risk factors for things like diastasis recti that are outside of your control. You can't change your genetics, right? But our modifiable risk factors from Nicole Beamish, Nicole Hill, married versus maiden name, showed that people that had persistent diastasis recti postpartum had less of a sit-up test, had a lower sit-up test score, which is a sign of rectus strength, and lower rotational torque, which was a sign of oblique strength, than those that didn't. And so those that decondition more during pregnancy, from a modifiable risk factor perspective, are more likely to have issues with DRA postpartum. And so that means two things. One is I am going to try and prevent as much deconditioning of the core wall during pregnancy as I can. And two, I'm going to strengthen the snot out of it postpartum, right? And so that has changed a lot for me. So now I have almost every single one of my clients, if they can tolerate it and if they are not afraid, though we have to think, where did that fear come from? It probably came from us, right? Like, then I'm going to have them doing some sort of sit-up variation or like six-pack muscle strengthening right up until delivery. And clinically, again, we don't have the research yet to back this up, but like clinically, I have had, if I can follow people in pregnancy, I have had very low rates of DRA postpartum, like approaching zero, because they never had a chance to decondition. And this is like this other amazing reframe that Margie Davenport, who's my supervisor, and I have been talking about, is what is the reframe around, is exercise safe versus how do we prevent deconditioning of pregnancy?
Yeah, totally switch that conversation. Yeah.
Totally changes it.
That's the thing though. Even with women who even just do light exercises, like, oh, I was strong in pregnancy. And then they are shocked in those first weeks postpartum. Cause I see my mom's 2 to 3 weeks in postpartum afterwards. And they're just that's what I love to do, a readiness screen for running. Cause I'm like, just for everybody. Cause I'm like, you need to know, yes, you were strong in that body. This is a very different body here. And I think people don't think that.
And like all of our running research is getting really cool. Like there was a study that came out last month that looked at gait and biomechanics that changes across pregnancy compared to controls. And we saw that people tend to be more upright, which makes sense. You got a baby that's like, your back muscles are working harder when you run. You have less activation of your butt muscles, which might be a sign of weakness or a sign of changing body. And those change compared to non-pregnant or postpartum people, like when you're making that comparison across. And so one, that's great. We get to see what these biomechanical changes are. But two, I am going to be strengthening up the butt if you want to keep running. Like, And
Well,
that's or in the erectors too.
and there's another side. I'm getting the authors mixed up, but I remember reading them both and being like, "Oh, here's the crossover." When we looked at running form in pregnancy versus postpartum, lots of times it's quite similar because moms are not using rotation because they haven't used rotation in 9 months, and so they end up being very vertical, not working on
Or they're holding onto a stroller, which is blocking it.
exactly. Yeah, exactly. And so that's why these things perpetuate if you don't kind of dive into them. But once you know that that's a thing, well, why don't we head it off in the first place? Like,
Yeah, like I think about that so much. We used to very much discourage running after a
right.
certain part, right, in
Yep.
pregnancy. And then we wonder why moms are feeling like they're getting shin splints and stuff postpartum. It's because we you haven't done any impact. And we see this
Right.
in our like my geriatric PhD, right? Like after 65, we start telling people, "Ooh, don't do that. Like running's going to cause arthritis and like your bones can break and all this type of thing," which is ridiculous.
Yep.
Our bones respond to load, so we need to load them. And when we go through
Yeah.
a period of time where we don't load them, we need to gradually return to that loading and
Yeah.
know that your body might feel a bit sensitive to that impact because you haven't been there for a while.
Right. That's one of the things. Impact definitely. And again, kind of looking at the menopausal lens and then reflecting back into postpartum in these two low estrogen states,
Mhm.
we need to work on bone and tendon health and that sort of thing too. But one of the biggest things that I think moms feel like in those early postpartum days is they just feel like heavy and like sluggish. And most mommy and me programs aren't going to include impact or plyos or anything like that. And a lot of people avoid them in the programs because they don't want to run into leakage. And then you get moms that are supposed to be doing impact in these menopausal programs and they haven't been doing it for the past however many years because they didn't get over the leakage. Like we need to introduce this like way sooner.
And like not be afraid of leakage.
Yeah.
Like so many times when I'm working with somebody postpartum or who's perimenopausal, postmenopausal, and they're having symptoms,
Yep.
I'm trying to find them. Right? Like if I'm thinking about like you have a sore shoulder,
Yep.
I'm never going to say you can never have pain ever again. Or if you have pain, you're failing rehab. I'm saying, hey, like you can push into a 2 or 3 out of 10 if it starts to get really sharp or it's staying for a long time or if it's pushing into that 6 or 7 camp, like
Yep.
that's too much. Your body's not ready for it. But it's like we don't think that with pelvic. And then moms feel so much shame and
Right.
discomfort because they're starting to get back to exercise and they do pee a little bit. And like,
Right.
especially early, I was like, hey, your vulva's still pretty swollen. Like, it's all
Right.
right. Like, it's good. Yeah. Like, I don't, no judgment here. Like, like
Yeah.
let's try and see. And when when we reframe that and give a lot of empowerment to our
Right.
clients, saying, hey, like, we're just looking for your symptoms. This is a sign that your body's ready for it or not, versus you're going to cause permanent damage and destruction to your pelvis.
Yeah.
It just really changes a lot, It's just
Yeah.
so great.
I do feel like, and if, for the most part, a few kind of outliers here and there, I do feel like this, 2024, there was a lot more normalcy, I think, behind watching people exercise in pregnancy, whether that be lifting. I mean, how many people at CrossFit games were pregnant? Like, and some were like early postpartum. How many Olympians were pregnant and early postpartum? Like, I feel like that has, I mean, there's still dudes that are like, you shouldn't be do this. You're going to kill your baby. No, no one's going to do that.
Yeah.
But I feel like in general, that's better. Would you agree?
Yeah. And as a researcher, I am so thankful to those mamas because it lets me get through ethics boards and say, hey, like, look, we have all of these athletes, and not just athletes, like our recreational exercisers who want
Mhm.
to, they signed up for a 10K, then they found out that they were pregnant and they want to still run that 10K, or like there's so many different scenarios
Yeah.
where they want to continue doing an exercise that sparks joy.
Yep.
And the more we have these examples, the more that we share those stories, the more that researchers are seeing, hey, there is a big need here.
Mhm.
We need to fill that. And like, you were talking at the very beginning about feeling like this is just like, don't we have this research? Like a lot of newbies thinking that. But if we look at our kind of trajectory of 1, women in sports, 2, women in research, and 3, inclusion of pregnant individuals in research,
Yep.
like some of these documents that are trying to protect and advocate for pregnant individuals coming into research studies is as old as 1994.
Right.
And right. And so like just saying, hey, like pregnant individuals should be in these research studies is just happening at the turn into the 2000s. And then now not only are we talking exercise, we're talking about like high impact, high intensity
Right.
exercise.
Right.
Right. And so we've had to like inch in slowly. And
Yep.
even just how many women are trying to run during pregnancy or are trying to do these things during
Right.
pregnancy. I would say that's even the last 10 years.
Yeah, even I would say less than that, honestly.
Yeah.
I would say less than that. And it's funny the conversations that I'll have with patients, and I'm sure you do the same, where the patient's very confident, like staying active, and a parent or an in-law
Mhm.
will pass judgment on them because that was not what was socially acceptable or medically acceptable at the time. And I think that's where there's still tinges of people being like, this is okay, right? And where it is so helpful that there's A, more research, B, more people just being out and active during pregnancy and postpartum, because we need those examples because those voices are still there.
Yeah, or they're saying, "Hey, this is your time where you don't have to try so hard,
Right.
come to my
Just
sedentary side."
rest.
Yeah, absolutely. But, like, that deconditioning, it matters, like, I've had clients who they were placed on pelvic rest or activity restriction in one pregnancy, but not the other,
Mhm.
and when they compare across, they're like,
Oh,
"Oh
yeah.
my gosh, the postpartum journey was so different when I
Mhm.
didn't have that same level of deconditioning." And this
Right.
is where I'm pushing back on our OBs and on,
Yeah.
our medical providers and so if I talk with any of them, I say, "Hey, where does this restriction come from?"
Mhm.
And so many of them have been open with me and said, "Honestly, this is what my
We don't know.
attending told me."
Yep.
Like, we really just don't know.
Yeah.
And I think it's important for us to recognize that there are certain things that happen in pregnancy and postpartum that we just have to wait and see, that we
Right.
have no control. There's no intervention. There's nothing that we can do. But that is a very hard pill to swallow as a pregnant person, just waiting to see if something's
Oh,
going to go
yeah.
wrong. And so
Yeah.
you're turning to medicine and you're saying, "Help me, like I need to do
Like,
something." And they're like, "Well, then don't do this or
right.
don't do that." And it feels like it's giving them, I think, a little bit of control, but really what it's also doing is making us a bit weaker when we have already a really stressful
Yeah.
event happening.
I've seen that come up a lot. It's funny. I'm sure you're in similar Facebook groups. I'm in a Facebook group about a podcast. It's really funny. It's called the Alley on the Run Facebook group. Alley on the Run is a podcast. Allie Fowler. It's a running thing. Anyway, she's super fun. But the number of questions in there about, hey, I'm pregnant, you guys are the first people I'm telling, and they're telling this whole Facebook group. Or I just went to my doctor, and like this person's like training for a marathon that's coming in like 4 weeks. There's a lot of that coming up right now.
Mhm.
And they're like, okay, I found out I'm pregnant, should I still run? My doctor says no. And like, they're not symptomatic, there's no issues, everybody's healthy, they've been training this whole time. And it's really interesting to see what the audience, with the other, just like lay people in the group, are writing back. Hey, you know what? You need to find an OB that's supportive of this. And if you're feeling good, like, and it's decent advice, which is not always how it
Right,
is.
for sure. For sure.
Which is kind of nice. And people say, and I understand that, not everybody lives in a place where, medical care is for it. And I'm sure there's places like, Utah and Colorado and Portland and things like that, where there's like huge ultra scenes and there's doctors that are very used to, moms running,
For sure.
trails and that kind of stuff. But like, it does honestly feel like it's almost like a grassroots tide is turning kind of thing. And if you're not on board, you better, because otherwise you're gonna get kind of mowed over.
Yeah. Well, yeah, and I think, we're seeing this in pregnancy postpartum, we're seeing this in menopause as well,
Yeah.
where our individuals who are menopausal were the ones who had to advocate for themselves for pelvic health and pregnancy postpartum. And they're saying, like, I'm not taking this advice as
Yeah.
this as it is okay for me to feel this way, or I should expect to feel this way because I'm older. Like, we have life. Like, I want to live until I'm 100, which means that I'm going to be postmenopausal for half of my life, right? If
Yeah.
average age of menopause is 50, then I'm living 50 years in a postmenopausal state. And I refuse to accept feeling like trash that whole time because I got a
Yeah.
lot of life to live,
I would agree.
Yeah. And so, yeah. So how do we advocate? And I think we have some physicians who are coming on board that are being such great advocates as pelvic health. I'm writing a lot of letters. Like, I'm throwing my PhD around. Let me tell you, like, I'm like, hey, I'm a postdoctoral researcher in pelvic health. Like, I have a geriatric rehab. Like, lens and like, here's some studies that are looking at, advocating for hormone therapies or whatever.
Yeah.
Like, I would love to come alongside you. And I think that having, someone like us who's a physical therapist in our menopausal clients' corner,
Yeah.
it feels really good. Like, to be able to have like this group, or like, just this advocacy piece around menopausal care.
Yeah.
But I always joke, like in my geriatric course, I was like, our muscles respond to load, so we load them. Our bones respond to load, so we say, how's chair yoga and aquafit? And then we wonder why our postmenopausal individuals are struggling with things like osteoporosis.
Right.
And, there's just so much that we can do to try and help and advocate for them.
Yeah, no, and like I said earlier, like I really feel like my nosedive into menopause has made me look at, postpartum completely different. And even, what are all the things that we're gonna need to do in both those phases of life that we really honestly like, can we start talking to our daughters sooner? Can we advocate for, you running and jumping and playing on the playground and kind of like, don't ever let that go away. That time period shouldn't end. I've really seen it a lot this year. So my daughter started middle school, and so they have recess, but there's no playground anymore. And it's almost like it's socially unacceptable to go to the playground. And they used to go for a half hour every day, hang, jump, run, and now it's gone. And I'm like, oh my God, is this where it begins? Is this where it
Absolutely.
begins? That these things that we're trying to pull back in play and running, jumping, impact plyos, lifting heavy things, throwing things around, like, is this where we start to lose it? And how do we stop that loss so that we don't have to retrain it at these other phases and stages in life? Or is that too much of an ask?
I don't think so. Like, I think so. My daughter's 5, so I'm a little bit behind you from a parenting perspective. But when I think about like lifespan, like female lifespan,
Yeah.
in adolescence, things like making sure that they're fueling appropriately and getting their period between 11 and 14 is hugely important, right? Because peak bone mineral density happens at 18. And so if they're under fueling in their teenage years, and it's not that like they're just athletic, so they're not getting their period, or their period is
Right.
very late or delayed, or, that can set them up for success when they're 55 and now
Right.
they have stronger bone mineral density, knowing that we're going to see some decline in lower estrogen states,
Yep.
right? Bring that bone piece to pregnancy postpartum. Calcium metabolism changes in pregnancy, which means that we have pregnancy and postpartum induced bone mineral density loss.
Right.
And we have some individuals who are in pregnancy who are already osteopenic.
Right.
Right. And they don't know that because we don't screen until 65. Right. But for most people, it's transient. And within 12 to 18 months, people's bone mineral density has gone back to baseline, but not everybody.
Yeah.
And how do we get bone mineral density loss? We make sure that they're fueling appropriately, that they are doing resistance training, and that they're loading their bones. But in pregnancy and postpartum, we tell you, don't load your bones, don't lift very heavy. Right. And it's the same thing that we're seeing in older adulthood. Right.
Yep.
As soon as, things start to hurt, or you start having musculoskeletal pain, or we decide that you are old enough, then we're going to start telling you that you should be restricting impact, restricting load, and then it's happening again. And so if we take this lifespan approach, it's like, one, we really need to actually think about the advice we're giving people in these like transitions, and not thinking, oh, this person could have bone mineral density issues, let's avoid these things. It's, hey, I'm trying to mitigate bone mineral density issues.
Right.
And this is what I need to prioritize. Like,
Right.
and that's across the lifespan. So like your daughter is in the perfect phase of like, we need to get to their coaches and make sure that they're eating enough.
Yep.
When some of the boys teams are getting full strength and conditioning classes, and your girls are getting agility ladders and plyo bands, like, that's not okay. Like, we need to get them strong. And then, that's why we wonder why for our female athletes, they are more likely to have bone stress injuries and ankle sprains. And those are all like, getting strength around their joints and making sure they're fueling appropriately, because those bone stress injuries are impact related. Yes.
Right.
But it's because there's not enough muscle to support that impact, and there's not enough fuel to support that impact.
Well, and then add in that you've got kids being pressured into doing one sport all year round. Then add in, the disparity, and softball is the example I use all the time, because my son did baseball through 5th grade, that boys pitchers have a pitch limit. Girls do not. Tell me why that happens. You cannot tell me that girls pitching softball shouldn't have a pitch limit.
Or that are we saying that women's rotator cuffs or girls' rotator cuffs are stronger and therefore more able to handle more pitching volume? Like,
no, there was a running study. Oh gosh, it was a couple years ago, looking at kids that, and I totally messed this one up apparently as a kid because I only ran and swam. Kids that do agility sports like ball sports, so soccer. I'm sure field hockey was in there, those sorts of things. They were less, and then went on to be runners as adults. They were less likely to have running related injuries as an adult than those that only ran as adolescents. I was like, yeah, I get that.
Forward and backward, forward and backward, forward and backward, right? Versus getting a couple of different planes of direction.
Yeah. So it's like these people that are like, yeah, I'm going to put my kid in, swimming all year round, and then they do nothing other than that. And I'm like, no, we're not doing that.
Well, and like our research on like early sports specialization is so consistent that it's not great.
Yeah.
But like you get into the fear of your kid being left behind and wanting to give your kid every opportunity and all those types of things. It's that pressure I feel like is very real.
Mm-hmm. No, I mean, yeah, when you get to that, let me know because we're in the thick of it right now.
Oh, it freaks me out. Like
we're
really just starting. I have a 5-year-old and a 3-year-old. And so my 5-year-old is in gymnastics on Monday. My 3-year-old is doing swimming on Tuesday. And I'm like,
yes, you're so far now.
Yeah. I was like, Carrie's telling me that I'm like hitting this stride of like hitting this area. So.
And that's the thing is in the beginning, you're like, hey, let's try all this stuff out. And then at some point, in order to participate, then you've got to do the extra stuff or the travel or this or that. And then there's just not enough hours in the day. And so then how do you choose? And really, is it fair to make a kid choose when they're like 7 or 8 what sports they want to do for their, high school career? No, that's not fair either. And then it comes back to us because we're shuffling all the time and we're in a car for, 3 hours a day. How is mom getting her exercise and, all of that. And so it all gets wound up together. Totally. It all gets wound up together.
Yeah, life's just hard. Like, and so when I think about that, and I was like, life's so hard. There's so many barriers that are outside of like my advice for people. Mm-hmm. Why are we restricting people more? And they're just like trying to make it work,
So you said restricting people more, and we've had a back conversation about this, and I'm pretty sure you know where I'm going. There's a lot of talk about kind of what exercises we should be doing at certain ages and phases in life. And there's a huge conversation of this regarding menopause. And my big concern about demonizing certain types of exercise, specifically like zone 2, that kind of stuff. And as runners, I'm personally offended.
I'm a new runner. I'm a newbie runner.
I know. Welcome to the club, by the way. We will talk about fueling. Okay. Yeah. Put a pin in that one. We'll come back to that. We need to talk about this half, my dear. No, but like, I don't know if Canada is like this at all, but in the States, I feel like we have such an issue getting people to be active. And it's hard to remember that when your work and your mindset is in the corners of the world where you think, oh, well, everybody's active, and they're not. It's like, how do you get people to have safe places to exercise and, good, healthy food and just to have those basic things. And then on this whole other side, you have people being like, okay, if you don't do this, if you don't do this, if you don't do this, then basically you're going to hell. What should the average person kind of like, how do you navigate that?
Yeah. So in terms of our over 65 population, 17% of individuals hit the exercise guidelines.
Yeah.
And I would say that is an overestimation because a lot of that data is coming from self-report, right? Yep. People are saying that they're being active. And so one of the things that I always say is tell me a time in your life where you wish that you were weaker. And then the flip of that is, do we have an over muscled culture? Like, do we have somebody who's too strong? Their heart is too fit. And you guys are like, come on, Christina. And I was like, but that's the way that we are messaging this, right? Is like, when I am thinking about, like, again, kind of going into my 65 plus lens, like, people are not exercising enough. Mm-hmm. People aren't doing enough. And so my main job is to remove barriers to exercise. Yeah. And so that is getting into what do they like to do? Yep. What is something that they are going to wake up and actually want to do it. Right. Because I can have the perfect exercise program. It's perfectly dosed. It hits all of these parameters, blah, blah, blah. And if they don't do it, it doesn't matter. Like,
Exactly.
it doesn't matter. And so when I talk about across the lifespan, you and I have had so many conversations about this, and this is where the black and white doesn't exist. We talk about risk tolerance zones.
Yeah.
Right. And so every single person that you work with is going to have a risk tolerance zone with movement. Right. And I would say with age, that risk tolerance shrinks,
Narrows,
like how much they're willing to push their bodies outside of that comfort bubble. And part of that is our fault as medicine providers, because we tell them to shrink it, right? Because we tell them that they can't do impact anymore, or that lifting is bad for their joints, or whatever that might be. But my job isn't to give them my risk tolerance zone. Mine is to meet their risk tolerance and get them engaged in something that is meaningful to them. Yeah. And so when I think about all of these like very restrictive, like don't do zone 2, like if the only thing I can get individuals to do is zone 2 training for 30 minutes, 3 times a week, I don't even want to say only. I was like, that's freaking awesome. Like, way to go. If you can get into that moderate intensity zone, you're going to protect your heart, you're going to protect your bones, you're going to protect your brain, you're going to protect your mental health. Like, we have research to back up that more movement is better than no movement. Mm-hmm. And there's a dose response curve that the more we do, the better. Yeah. Right. And then you can get into the weeds of if you want to optimize this or biohack that. But we need to start with the fact that 17% of people are hitting these exercise guidelines. Yeah. And then we have some of the data like the blue zones, which, you know, there's some like question marks about some of that data. But what they show is that when you are in an environment where it becomes easy to exercise. Yes. So when you are in a space where like you have to walk up and down hills for just your day-to-day movement, staying fit and healthy as you get older becomes easier. Yeah. Right. I have a gym in my garage, like, and I work from home. I have no barrier now as a busy mom who, you know, my kids are done school at 3:30 and then they're off doing this and that. And like, I don't have to go to somewhere else and I can be in my garage. And sometimes I'm super tired. So I just get on my bike and spin my legs for 30 minutes. And that removes that barrier. But like when we make it too complicated, then we're like, I'll forget it. Yes.
That's a conversation that has come up a lot with friends the last couple of years. And I think the impetus was the sitting on the sidelines because your kids are doing so much stuff. And I don't know how long you've sat on a sideline on a stupid bleacher. It hurts. I don't care if you have back problems or not. It is not meant to be sat on for a long time. And I think when you do enough of that, and then you're in the car and it doesn't feel good. No. And I'm lucky enough to have friends that will just like go walk during practice and just, even if it's just like walk around the pool or something like that, and it gets contagious. And then you get to socialize and then you get to do other stuff. And I think it really does make a difference to finding those little movement snacks. But again, to your point on these talks with my friends, they're coming to me and saying, okay, I'm probably in perimenopause, menopause. I'm hearing all this stuff. Am I supposed to be eating 130 grams of protein and going to the gym and lifting weights and doing all this stuff? And I don't have time for this. And then they don't even know where to start. And it's like they're spinning around and they've done nothing. And I'm like, no. Us walking right now, that's the first start. Yep. You know, throw a little Fairlife protein in and chug that down after your walk. Okay, that's the second one. Like we got to take it one step at a time. But I really feel like people want to do, it's just like postpartum again. I want to do the right thing. The right thing is just, okay, what's an easy thing to introduce and stay consistent with, and you don't hate it.
Yeah, you don't hate it. And I think too, like the mindset for me over the last year, this has been the hardest about engaging in exercise that I have ever had. And like my kids were a little bit older, and it was because I finished my PhD. I started my postdoctoral research. I moved to a different country for the third time. I started back in clinical practice again, 1 time a week, which was great. But there was a lot. My kids started going into swim stuff, and I went from training 10 hours a week to be a CrossFitter and be at a very high level to having to let that go. And like, honestly, it spiraled me. Like I was just like, I had all these expectations of my body and I put some weight on, which you would expect when you're bringing your volume down by like half. and that's where the half marathon came from. Is one, I needed to get outside because I was working from home and I needed some sort of stress regulation.
Yep.
And two, I needed something that I had absolutely no expectations on my fitness about. Because I'm not a runner, so I'm just doing it as
That's how I feel about CrossFit.
yeah. So like you flipped it, right?
I
And
flipped
so
it. Yeah.
yeah, you flipped it. And so you're like, I have no
Yep.
expectations of this. I'm not figuring out paces or whatever.
Mhm.
Which was my big mistake on my half marathon because I was like, I'm just a newbie. I don't need to think about anything.
Well,
And
yes and no.
right, exactly. And then my husband's like, it doesn't matter if you're a newbie, 21 kilometers is still 21 kilometers, Christina. I was like, I got a really good I told you so. And then my husband and I also joke that like when we were younger, we would always say like, who works out at 5 a.m.? Forget that nonsense. And then you're a parent with 2 little kids. Yeah. And so I work out at lunch and he works out at 5 a.m. because that's the only way that we can, consistently make it work for, a busy family life. And so like those expectations. But if I would have said like I have to maintain 10 hours a week or else it's not worth it anymore, or this exercise like that all or none, like only HIIT training and not zone 2, or you have to do with this resistance training this way or don't, like it makes it stressful. And exercise is supposed to be fun. It's
100%.
It sparks joy, like to move your body. Like, and for me, it's been so joyful too, like bringing my kids into it. But if I'm expecting that I'm going to have this perfect run when my daughter's with me on a bike, like forget it. She tells me she needs a breather and then her hands are cold. We have to go back and
it's always something with them. Yeah. No, my daughter's like, can I go for a run? I'm like, really what that means is you want to walk for 5 minutes, run for 3, and then you want a snack. But at least she's got the snacks down. She could teach you something.
Yes, that's exactly it. But like
all about the snacks.
Yeah, all about the snacks. Yeah. So, but like, it's this, we've talked so much about how it's hard to understand nuance, right? And like the nuance, it's in the weeds, right? It's as clinicians, we have to critically think that like my recommendations for one person is not going to be the same as my recommendations for another.
Right.
But when we're going to the foundations of it, we have to take where the person is, take where they want to be, and remove barriers to whatever it is that they want to do. Right. And it's not about what I think is right. It's what they think is right and what they're willing to accept from a symptom perspective. Like,
I think that's also one of the biggest kind of gifts or roles that we can play as a clinician, because recognizing that there's a lot of different seasons and change, and having kind of experienced that ourselves, coming from a position of expertise, supposedly, where we can tell somebody that like, and I don't know how much is being a PT and how much is my mom's street cred, but like, if you are not sleeping because your child is in sleep regression, choose the sleep over the workout. I can do that. Yeah, you can do that. And then when that goes away, then we can get back into it again. Or, when you get back to running and your kids are in elementary school, don't feel like you have to get a marathon PR when the last marathon you did was 10 years ago and finish and do like, you don't have to do all the things all the time. Oh, I don't. No, it's not, you're not going to die anytime soon unless we didn't talk about this. But like, I think giving people permission to have fluctuations and changes, and it doesn't always have to be foot on the gas forward. It kind of reminds me of when I was a kid, that like the kind of the conventional wisdom was you got to run every day or it doesn't count. And I remember always on like January 1st, I'm like, I'm going to do this every day. And then of course you skip a day and that's how resolutions die. But like, no, that's how you screw up consistency. Like show up whatever you can in those circumstances. And I think us being able to work with patients and help them find a way through, giving them permission to, hey, in this, it looks like this. And as soon as that shifts, then it'll look like that. Like that's a lot of power to give somebody.
And it's like the total Brene Brown thing. It's like, if you only have 30% and you give 30%, you gave 100%
yes.
effort. And good for you, mama. Like,
yes.
Like you're doing so great.
It's totally reframing it. But I think especially our younger moms, it's like they need somebody to kind of give them that perspective. I'm like, it's not going to be 100% all the time. Trust me. Even now, like I came home last night and it was a shit show and I didn't get anything done.
My son was supposed to go to swimming and someone pooped in the pool and then he lost it because he couldn't go swimming anymore.
That happens.
It
Yeah. At
happens
least it
every
wasn't
so much.
him pooping in the pool.
It wasn't him, thank goodness.
Yeah. Welcome to swim culture, by the way. Are you guys doing indoor swim or outdoor?
Yeah, indoor
Okay.
swim.
Indoor is a slippery slope. Be careful.
Right now it's just taught and parent.
Yeah, but like then it's really a quick slide into, okay, are you gonna compete? Are you gonna do a 25? Okay, well, how about a 50? Like
Oh,
then it's
man.
just like, how many days a week are you swimming? And
It's
we
a lot
did
of
a
early
hard
mornings, right, with swimming too?
nah, summer swim for us. Winter swim, it's later. We kind of stepped back a little bit this year. My daughter's doing developmental as opposed to competitive, which means there's no attendance requirements, there's no meet requirements, there's no parental volunteer requirements. She's just showing up a couple times a week or once a week or whatever. And that's a lot more chill. But unfortunately, that puts us at the less ideal practice time. So it's like 7:15 to 8:15 at night. And when I go to bed at 8:30, that makes for a challenge.
Yeah, so then maybe you're trying to figure out how to get you just go in your PJs. That's the going.
Well, yeah, I think we'll be able to do that soon because she's had field hockey right before with an hour buffer in between. So she does field hockey. We camp out in the car with the dog with snacks for an hour, and then she goes into swimming. And by that point, I'm just tired, so I just take a nap in the car.
Yeah.
Not the most ideal. Last year we had a nice ideal thing. She had something every night, so I walked every night at the same time. It was great. The dog got in shape. It
Yeah.
was all good. This year,
Yeah.
not so much. Not so
Yeah.
much.
And even like within seasons when you think that you have it all figured out, all of a sudden you just don't have it figured out anymore.
It changes.
It changes, yeah.
So let's talk about your half marathon experience here. At what point in the half marathon had you realized that something had gone awry?
All right, so for anybody who does not know me, I haven't been a barbell athlete through and through. Like the last 10 years, I have competed in CrossFit, powerlifting, or weightlifting. So all strength-based sports, you can have snacks in between reps. Like it is not the same at all. It's been really fun coming into the running community because it is different. Like there's like stereotypes for CrossFitters and powerlifters and weightlifters. They're all true, and it's just so fun. And then there's runners, right? So now everyone's asking me about split times and like.
Oh, I don't care about your splits. I just want to know, at what point did you start to feel like shit?
Right. So then I was like, okay, so this is my first half marathon. I just want to like say that I can run.
They're hard, by the way. Like halves are not like, hey, just do 3 5Ks. It's not that at all.
No, it wasn't. And I was feeling pretty good. Like it had been great. And so what I had done with the half marathon is I was running 3 times a week and then cross training once a week, trying to get 1 to 2 times for strength training. And it was a way for me to get outside. And I brought my lab with me, and like my dog and I would run. It was great. So I had tried a couple of fueling, like I do like basically it's like almost a 6-kilometer loop around. We live out in the country. And so I would just like stop, grab some water, grab gel, and like go. And I was like, sweet, I'll just grab what's on the course. And my husband was saying like, make sure you're hydrating, but he's like, maybe you need more salt like the night before. And I was like, Nick, like, come on. I'm fine from an electrolyte. Yeah, Carrie's already like, this is the wheels are already falling off. And I was like, we had chicken noodle soup, which is like high sodium. I was like, that should be like a good boost. I don't need to think about anything else. And then on the course, I'll try and stop every 3 or 4 miles, and grab gels and electrolytes. So what really fell off for me is that the gel that was there tasted like I was eating Nutella. And so it was
what did you
gross.
have?
Like it was chocolate, like I don't even know what
though.
It was thick.
Yeah.
And what I found out now is that I should have been training myself to eat something like that on the course. And I
bring
didn't.
your own if you don't like it. Yeah.
But
they have. Yeah.
I thought it was like, I was like, I don't need to get all like fancy with this. I'll just like get whatever's on the course. And so I PR'd my 10K. I did like 58 minutes. I was feeling so good. And then 13 came and my lower abdomen started cramping.
Oh, tummy trouble.
I had good bowel movements in the morning, like was feeling good. Doesn't matter, but it did not matter. Like by the time I got to 18 or 19 kilometers, I was like, this is so painful. Like my butthole was cramping so bad that it felt like, like right before, if you've had a non-epidural delivery, like baby's going to come out. Like that was the rectal.
Oh no, that's horrible. I'm sorry.
It was horrible. And if I was not doing this half marathon, I would have just walked right off the course. And so the worst part is that my fitness was there. It just like my fueling was not there. So I just did not have enough electrolytes, and I did not have enough calories on the course. And so you're right getting around that hour plus mark. I was at
Yeah.
13. So I was like probably an hour 20, and then it really started to get bad over 90, which is like
Yep.
that arc around when you like are
Yes.
starting to deplete glycogen and whatever.
Yeah.
And so I learned a lot, and I finished it in 216, which was I was hoping
Which
to
is
go.
still good considering you're like about to die.
Yeah, right. I know. I was at like a 205 pace, and then like the 210 marker passed me by, and
Oh.
I was like, oh, I just can't do it. It's just so painful to run. And so I did a lot of
Mm.
walk running in the last, especially
Yeah.
4 kilometers. It was really
Yeah.
starting to hit. But yeah, it was a really big learning
I'm sure you've
experience.
got a ton of advice after you like what was some of the advice that you got when you kind of posted?
Okay, so yeah. So this is where social media is amazing, and this is where the running community comes in.
Mhm.
I was like chastised. Like it was so funny. Like people were being so helpful, but it was hilarious because it was like as soon as I posted about it, I realized how big the running community is in like the best way possible. I had like probably 40 DMs
Oh, I'm
within a couple
sure.
of hours of like, what was your fueling? What was like asking. I'm being very rigid about it, and I don't think that I portrayed enough around how, like, laissez-faire I was about this, like, I was not trying to be hardcore, like, this is, like,
Yeah.
I'm going for the participation ribbon,
Mhm.
like, that was what I was doing, and so I was like, "I don't know," like, I don't know, or, like,
Mhm.
how much I took in or, like, how many grams of carbohydrates, and so
They can get a little much. And I think I have a little perspective because so I did my first and only marathon back in '04, and that was back when you're like, maybe I'll eat like a granola bar in the middle and you're trying to chew. And of course, now there's like 17,000 types of gels and
yeah,
different salt amounts and how many carbs. And I think in certain situations, like if you're running an ultra, yeah, you need to be sure to stuff down the calories because at a certain point you don't want to eat anymore and you just got to do it. But I here's my simple bit of advice, and I think people look at me like I'm doing a little bit too much, but damn, I feel good afterwards. I always run with fluids, and I always put none in it with ice because I like ice.
mhm,
I will drink every mile, like a sip, so it's something.
yep.
Um, if I'm running longer than an hour, I'll have a gel every half hour. That's it.
Yeah, see, I
That's it.
think I just needed some sort of, like, very easy, simple thing like that
And then
because
on my Garmin, I set a 30-minute timer.
mhm,
So when that one goes off, then I know to eat my gel around that time. And then
yep.
just when I hit a mile marker, I take a sip because I'm like, I can't do math when I run. I refuse. Keep it simple.
Right,
Keep
and
it simple.
yeah,
And it
and
better
I just
be
yeah.
not a like putty tasting. Like I know everybody loves Morton, which is like the Swedish one that's supposed to be like the best. I can't, it's like the taste in my mouth makes me want to hurl. I'm like, I need sweet, happy.
Well, that's what it was, like, it literally tasted like Nutella on the race, and I was like, "This is disgusting,"
No.
and I shoulda just, like, slurped it back, like, looking back, I was like, "I shoulda just dealt with it," like, I was just kind of, like, sipping at it really
Well, but here's
slowly.
the thing too, there's some of them that, you have to have with fluids and some of them you don't.
Right,
And
like, I
so
didn't
if you
know
didn't know which one it was,
no
so
idea.
that's the problem too, like if it was the one that you need to have fluids with and you didn't have enough fluids with it, it can cramp your tummy up too, so
Yeah, so, like, there was just yeah, exactly. So,
but keep
obviously
it simple next time. Bring your own, shove it in your shorts, shove it in your bra, all
right.
good.
Yeah, and so, like, usually for me too, like, if I have an athlete who's doing a weightlifting or powerlifting meet, I was
Mhm.
like, "Just bring what you would normally eat," and,
Yeah,
like, I say, like, "Don't get in the weeds of all this other stuff, like, don't try and manipulate your
100%.
weight, whatever," and so I went in with that same mindset into this half marathon,
Oh,
which obviously was a big mistake, and now I will forever be changed from having that like,
there's nothing quite like the feeling, and I learned this 2 years ago. Yeah, it would have been exactly 2 years ago 'cause I did a 10 miler for the first time in a long time, and I didn't fuel, and I just did the Gatorade on the course and that kinda stuff, and I finished and I felt like shit, and I, like, had to
this
walk,
last
and
one
I
that
was
you
like,
just did?
this is so Army 10 miler is October every year, and I did it in 2022, and felt awful, and I
Okay.
was like, "I don't ever wanna feel like that again," and then 2023, I got a run coach, did a better training program, and then actually started to find my own fueling, and felt a million percent better last year, and then this year, it was hotter, and I didn't wanna eat and drink, but I made myself do it because I was like especially in the front end, if you skip those first aid stations, it's gonna bite you in the ass later
Mhm.
on, and I always tell people that, and they're like, "Oh, I'm not thirsty." I'm like, "You will be."
Yeah, so
Um,
try and catch up
it's
to it
it's
after.
yeah, and it's the same thing, you just gotta hit it on the front end, so I don't worry about any of that stuff now, which is good. But no, it feels awful. You
Yeah.
feel like you want to pass out. It's
I was
not a
in bed
good.
by 6 o'clock that night.
Oh, easy,
I just like
easy.
left my husband out to dry with the kids. I
Mhm.
was like, I'm so sorry. He was so good
Yeah.
about it. He was
No,
so good about it.
it's funny in running is a lot better now than it used to be about like how much you eat and that kind of stuff. And there's the alter community is actually really good about this too, because obviously if you don't eat food and they eat like actual food, but there's this one podcast, it's a Trail Society podcast. They have a motto. They're like, big dogs got to eat. Are you eating snacks? And they literally remind you during the podcast, are you eating a snack now? Are you
That's
go to
awesome.
feed.com, eat your snacks. And then
That's
they talk a lot
awesome.
about red S and all that stuff too, because obviously that's
It's
in
hugely
that community.
important.
But I love just the fact that we can talk about eating
Yeah.
and food and that it's
Yeah.
normal.
I
So
love
eat
it.
more.
Yes, eat more. And one of the things that I think is really cool as for me as a physical therapist, like one of the best things that you as a physical therapist can do is try new things, right?
Yeah.
Like to know what it feels like to
Yep.
max out your squat, to know what it feels like to do a high intensity interval, to know what it
Yep.
feels like to do a track workout, to know what it
Yep.
feels like to try and swim and not die and drown. Like that would be me, right? Like and now like, I have a unique perspective now, like with the running
Perspective.
community, like I could serve the running community before,
Right.
but
But now
now
you
it's
know.
very different being in that, like having tried it. And again, I'm
Yeah.
not trying to be a crazy, like really high level runner, but I also know like, oh, like these are things to consider. Or like if you really
Yeah.
hyperhydrated, then maybe you don't have pelvic floor dysfunction, you just have a full bladder. Like,
Right.
or like depending on the run, when time you're running, it might not be that you have anal incontinence. It's just you have rectal bulk, and it's just when you would normally have a bowel movement. Like,
Yeah.
but until you try those things, like, and this is a problem I see in physio, it's a problem that I see in the research is like
Mhm.
when I look at these protocols, I was like, you've clearly never done this before,
Yes.
because 3x10 at your 10 rep max is not a possible prescription. The reason why it's
Mm.
a max is because it's not repeatable.
Mhm.
Right. And so I think about this in our research. I was like, how much of it is not 100% accurate because our prescription doesn't make sense? But unless you've put yourself into that, unless you've been a coach or coached
Yes.
or done those things, you're just going to take it at face value.
Yeah.
And so many of our health intervention researchers, they know the exercise piece, but it's the clinician that has done it.
Yeah.
It's the athlete that has done it. It is the person who has gone
Yep.
through these protocols that has given me just as much information that helps my clients
Yes.
as me knowing the RCTs.
Yeah. No, that's exactly honestly how I got into CrossFit was I went to a class because I had patients and I needed to learn it. And then I walked in and I was like, oh shit, I need to learn how to do this. And my whole first year, I just shut my mouth and learned. And I was like, I don't know what I'm doing. I'm out of my league here. I have no space to talk. I'm just going to learn. And that to your point on the clinical side of things, I do appreciate that there's so many more clinicians in our space that are learning things to be able to, treat the lifter, to treat the runner, and that sort of thing. But stuff gets missed, and people treat on algorithms and not on what that person needs. I see it a million times over in working with runners because they're like, oh, well, when you run, you're supposed to do X, Y, and Z. And I'm like, except for da 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 da. And like everybody feels like, okay, you need to change runners' techniques. I'm like, no, that's the last freaking thing you should be touching. How about these other things that you've totally missed? But they learn runner equals this, 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 or lifter equals this, this, this. And they've never done a push press, or they've never done a snatch, or they've never, and I'm like, no, 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 you can't do that like that.
Yeah. Well, and I think one of the good examples is that Return to Running post by Goon Brockwell and Donnelly. Like
Yep.
if you talk to them, like the goal wasn't to be that this was a hard, this is how you
Right.
have to do it. It was, they were putting an idea saying, hey, we have nothing. Let's break down running and give some ideas.
Yeah.
And we don't have research to say, okay, if you pass 5 out of 8 of those screening, I don't even know how many numbers it is, then you're good to run, or your relative risk for getting pelvic floor issues with running is this versus not. And yet it's become the gold standard because we want that checklist.
Right.
Right. And so if you have a person who passes 11 versus 12, what's your advice? Versus 5 out of 12, what's your advice? Or like I
Yeah.
have a person with a 2 out of 5, which would be considered a relatively weak pelvic floor, who doesn't leak until 5 miles in,
Right.
versus somebody who has, a 5 out of 5 with a very strong contraction who leaks as soon as they start running.
Yes.
Right. And so that's where the nuance comes in, where maybe for the person with a 5 out of 5, I need them to stop contracting their pelvic floor as they're running.
Right.
And it has nothing to do with their strength, despite what the checklist says that they should be ready for.
Yep.
And the person with a 2 out of 5, yeah, we're going to start increasing their strength, but I'm not going to stop them from running until they hit that 3 out of 5.
Right.
I'm going to keep them running, but maybe get them to do walk run intervals just shy of when they start to pee, so they can bring some of that tension down in their pelvis and then go again. Like, that's where you and I have had so many conversations around. It's different.
Critical thinking.
Yeah.
No, I'm thinking of somebody specific. I just got this email over the weekend. A client that I worked with virtually, I think 3 sessions over maybe 6 or 7 months. And she was a couple years postpartum and had worked with 4 physical therapists in her area. And some were running physical therapists too. And she kind of had done all the things. And she's like, I leak. And she was trying to train for a marathon. She's like, I leak basically after 8 and on downhills. I'm like, well, that's easy. And she's like, what do you mean? And I'm like, what do you do for strength training? And she's like, nothing. And I'm like, okay, so let's, and here's the thing too, is you can have people that pass a running screen and leak, and you can have people that fail a running screen and they're fine. It's a tool, like use your brain. It's not the be all end all, like carved in stone, which I know we both agree on. But this particular person, it was my job to listen to where the problems were. She didn't have any downhill specific strength training. We did that. She wasn't doing any impact training. So we literally did just these very, very simple things. She sent me this lovely email over the weekend. She did a 10K with a stroller, completely dry. And the year before she was soaked. And by the way, the day before she did the 10K this year, she had done a 17-mile training run, totally dry. And I was like, I didn't put my hands on her. I literally, like, different part of the country.
Yeah.
It was with good critical analysis of her story, where her actual deficits were, and the ability to kind of problem solve and pick those pieces out so that we actually fix what's going on instead of the general stuff. And I don't think it's hard, because it's almost easier because you get to see what everybody else did and what didn't work. So it's almost like easier. I'm like, well, where are the gaps? That's probably where it is. But again, it's like, if it's a pelvic floor issue and it's downhill running, it's not always the pelvic floor.
Yeah.
Do you know how to
load of the quad?
Yeah. Do you know how to downhill train for runners? And I had gotten into that a little bit with trail running this year. And I'm like, if you don't know how to get yourself ready for downhill trail running, that's a whole other animal. If you do a trail run, talk to me first. There's a whole separate thing that's different from road running.
It sounds redundant. And what I am trying to learn too is, like, I had only worked on sprinting mechanics. And so I was overstriding compared to long running. And so I had one of our faculty with ICE do just a running analysis on me this weekend, because I was trying to drive my legs forward like a sprinter would, my knees forward to, like, really run. And then I was overstriding, and Tib Ant was angry at me. But, like, you know what I mean? Like, those are things that have nothing to do with, like, being really specific to the pelvic floor. And it's just around, like, listening and evaluating and being able to kind of be unbelievably curious. Cause I do too. I always joke that I get chronic, complicated, and cranky. And so, like, oftentimes I'm seeing individuals that, right, like, especially I work in geriatrics, right? Like, I do a lot around postmenopausal women. And so, yes, they have pelvic floor dysfunction, but they also have arthritis here, and this comorbidity and inflammation is high from this. Like, there's just a lot, and we can get into the weeds, but, like, where the critical thinking is like zooming out and saying, okay, like, what's the next step for this person to remove one of the biggest barriers for them to move?
Yeah. And it doesn't have to be so freaking complicated. It really just doesn't.
I always joke too, like, if I think about rehab, I am doing one of 2 buckets. It's body not strong enough syndrome, whether that's like tendinopathies when I'm interacting with aging, because we lose strength with age. So if your activity is constant, but your strength is going down, then things might show up that didn't. Or if the ground reaction force when you fall is greater than the tensile strength of your bone, then you fracture. Like, that's the bucket. Or it's not recovered enough syndrome. Because now when we look at our health promotion data, sleep, stress, nutrition, recovery is a big bucket around building this bucket of strong enough syndrome to stay at that same depth. And so I have these 2 buckets, and I am using my manual therapy to slowly, like, bring down pain but then I'm working on building up the buckets. So either making your recovered enough syndrome bigger so that you don't have this bucket that's overflowing because you're
Right.
too stressed out or you're not sleeping well. And then I'm building your capacity for the strong enough bucket so you can do everything that you want to do.
Yeah.
We like to make it complicated, but like everything in rehab can be into those two camps or both.
Right.
And
I think
then
that's an easy enough thing for a patient to understand though too, right?
and I draw those buckets out for my clients every single day. I was like,
Yeah.
like just like, you said about not sleeping postpartum. I was like, right now, your recovery bucket, not that great. That's okay.
Mm-mm.
Like I can't tell your newborn to sleep more. Like you're not gonna be able
Mhm.
to tell your newborn to sleep more. But know that your recovery bucket isn't as full as it needs to be. And
Yep.
so your body readiness is not going to be the same. And that's all right. We're just going to make sure that we maybe inch you up in volume and intensity slower than if you were
Right.
sleeping through the night.
Yeah. No, and
Or you work 3 days a week instead of 6 days a week.
right? Well, and I think that's also, I mean, credit where credit's due. I think that's where that mom experience is invaluable. I had a kid that didn't sleep for a really long time, and I know that feeling, and I know what it's like to be like, I can't do what I want right now, and you're just like, you feel like you're constantly drinking from the fire hose, and to be able to validate that for someone and give them again the permission to be like, hey, this isn't going to be forever. I know it really feels like it's going to be right now, but I need you to get this sleep, because if you don't, it's going to make things worse. And being able to have permission to have a conversation about it and have that be part of the clinical pathway, because
And
it really, it
that
does make that the holistic and like that whole person.
and that conversation comes up again with me around menopause. I call it the
Yeah.
menopausal witching hour, 2 to 3 a.m. That's when my clients are up. They're like,
Oh yeah, it
it's
is.
like 2, 3 o'clock. I'm awake and I don't know what
Mhm.
happened. I can't fall back asleep.
Don't pick up your phone because you won't go back to sleep.
And I was like, it's this, like it's like almost the same thing, right? Like if
Mhm.
you're like either like you're getting hot flashes and it's making you hard to go to sleep, or
Yes.
something's happening from a brain fogginess sleep
Yep.
perspective as you're transitioning through menopause.
Yep.
If you are not sleeping, just know that that fatigue trickles into the day.
Right.
And so when you're thinking of exercise, oh my gosh, I can't think about having the energy. I'm just trying to get through my day. Then we
Mhm.
start doing the same thing, like releasing those expectations, talking about movement snacks, like trying to just encourage activity 2 to 3 times, like all of those, like it's so funny how it's like kind of cyclical, right? Like where now it's like this tiny human is dictating your recovery
Right.
bucket. Now it's your hormones are doing your recovery buckets. And so
Yeah.
like like those menopausal symptoms of brain fogginess and increases in joint pain and fatigue and lethargy, depression, anxiety, like those buckets are signs of menopause, and it can make it so that you don't feel as motivated to go into exercise.
Mhm.
And so
Yeah.
acknowledging that those exist and then also like talking about how to work through some of those barriers,
Mhm.
it's it's a lot the same.
It is. I feel like it's a lot of the same, but then also what really drives me nuts, I'm sure you've seen the memes where people are like, it's some like video in the background of like somebody getting trashed out of nowhere, or like hit by something, and like, oh, and then perimenopause shows up, and I'm like, I'm done with the memes because we did them in postpartum and they're not funny. Um, it's also permission to have the conversation that you can go talk to your healthcare provider and have discussions about your quality of life, whether or not that includes, whether hormone replacement therapy would be right for you, or, estrogen, testosterone, progesterone. But at least have the conversation and know you don't have to suck it up or wait it out, or this is just what it is. Because again, like, I feel like we went all through that in postpartum, like, oh, this is just what it's like. And like, no, it shouldn't necessarily have to be. Like, let's not
I
do this
always joke, I was like,
again.
did you know that because erectile dysfunction is largely vascular, that we could make the argument that loss of erectile function is also part of the man's aging physiology? And like nobody ever hesitates to give some Viagra or Cialis. Like, I always joke about being like, changes in libido are a normal part of the male aging experience. So it's joke be like, that when we give out Viagra like Tic
Like
Tac.
candy. Yeah, exactly. Where's mine?
But
Uh,
I think that emotional experience is important, and I don't know about you, but I
yeah.
have a lot of people that kinda end up tearing up in my office because
Oh,
you're
at
the first
least.
person to ever listen and, like,
Mhm.
give space and
Yeah.
acknowledge the emotional side. I was like, "I know that this is really hard." And, like,
Mhm.
emotionally being in pain or feeling foggy or feeling like this body is not your own, and whether
Yeah.
that's pregnancy, postpartum, or menopause, like,
Yeah.
those conversations when you were going through big changes in our life are very
Mhm.
real because they're changing your baseline. And whether that's
Yeah.
temporary or permanent, that is a very difficult conversation to have. And,
Yeah.
and it's an emotional experience to have too.
Yeah. No, I think so too. I mean, I always keep the good Kleenex with the lotion in it. So I'm like, because when you work in a hospital, you only get the cheap stuff. So I'm like, if I ever have my own practice, I'm gonna have the good
Yeah,
Kleenex.
good stuff. The good stuff.
we
Yeah.
we don't skimp on that around here.
No, no. Love it.
All right, Dr. Christina. I almost said Miss Christina. All right. We need to wrap this up here. Couple questions to finish on. What are you reading? I think I know what the answer is going to be.
Oh my
And it's not going to be research related or podcasts you're listening to right now.
Yeah. I finished my PhD and then dove into fiction so hardcore.
It's
I
all
did
like
like,
dragon drama, isn't it? Like,
oh my gosh. There's like a meme that was like, nothing is like you're hitting your 30s. Like, how's the fairy smut and your marathon training going? And the first
yes.
comment was like, nothing about my personality is original. And I've never laughed so hard in my life because that was totally,
Yeah.
it's totally me. So I'm reading a trilogy by Adeline Grace called Belladonna, which is about like death and fate and interacting, and it's like a mystery fantasy book that has absolutely nothing to do with my research.
I go through my fiction stages too. I totally missed the dragon smut phase. I don't know what happened to, Gen X here that I missed that, but
A Court of Thorns and Roses, that was the smut, and then like the fourth wing, which was the dragon
Okay.
series. Its third one's coming out next like February or something like that.
Not
And
a
my husband and I read them
family.
together, which makes it super fun.
Okay. My husband does not read. I mean, like, he reads, but like he doesn't read for fun.
Yes.
Which is awkward, but no, I always have a book next to the bed and I go through some fiction phases. But lately it's been not. And I did a lot of like summer fun reads like Elin Hildebrand, that kind of
Yep.
stuff, like beachy reads. And I'm like, okay, it's fall, we gotta come out of that now. So.
Abby Jimenez was my beachy read.
You were listening. Now, were you listening to some of those in your marathon training or your half marathon training too? Okay. Because we
I
chatted
always
about
listen to
that.
audiobooks. It's funny,
Yep.
I don't listen to music because in my head when I'm running, I was like, okay,
Mhm.
one song's 4 minutes. And instead,
Oh,
I get really weird. So, you know what? I just like immerse myself in a story. And
that's
honestly, there's been
weird.
times where I've
Okay.
literally truly felt that runner's high. Like I did a
Okay.
12K Friday before I went to teach a course in Michigan.
Yeah.
And I said to my husband, I was like, this was amazing. I could have been
Mhm.
running for hours because I just
Yeah.
like, hit that flow state,
Yep.
It's just so
Yep.
good.
If I'm just doing like long miles and I'm not having to think about, I'll put on a book or a podcast or something like that. If I'm doing intervals or speed work, I can't because it's like I need to just go with the tempo of the music or something like that. It has to be a little bit more kind of emotional, like head down, we put a little rap on or something. The playlist gets diverse.
Yeah.
All right. Let's go with the last year. What's been your favorite activity this last year besides Dragon Smut?
Well, reading again for fun has been wonderful.
Right?
Versus reading only research. What is a favorite activity? I think for me, with my kiddos getting a little bit older,
Yes.
having them come into exercise with me has been like such a huge joy. Like, and having my little one old enough, well, she's not really that little anymore, to do stuff with me. Like she will go for runs with me. She went to get her nails done with me this weekend. And so like, and her and I have actually started playing Pokemon Go together so that we do adventures to hatch eggs. So you have to travel 10 kilometers.
Yes.
And she's like, Mom, let's go on an adventure. We got to hatch this egg. It's 10 kilometers. And so
It's
we never
serious.
go actually 10 kilometers, but it's been fun to like play this game, like, this interactive, like force you to get outside type of game.
Yep.
And so it's been really fun to kind of connect with them on things that they're starting to enjoy,
Yep.
So
it's really cool. I mean, that's the good news, bad news part about all the activities is you do spend more time with them in the car. And I think, my daughter, cause she has a few more activities, like that's really where like, she's my buddy. Like we catch up on all sorts of stuff, she'll come with me on walks and that kind of thing. My son's a little bit tough. He's a little harder nut to crack. Cause he's a little bit older and teenagers just, but he still has time. So he'll come out and walk the dog with me and that kind of stuff. But yeah, it's getting them out and figuring out a way to push that button that they just spill their guts and make it a space that's safe for them to do that. And as long as that's there, like I just, every day that they do it, I'm like, just keep it open. Cause I know there's going to come a day they're not. Or hopefully it won't come, but still, still.
Yeah.
All right. Mom advice. You're a couple years further into this now. Any new advice?
That's a great question. I think that my advice is always that some movement is better than no movement.
Yeah.
Like, get rid of the expectations and just know. And also, like, a mom that's healthy is a baby that's healthy. Like, so many people think that it's like selfish to exercise themselves, but like we haven't even touched on like the mental health side of things. Like all of our postpartum exercise research is those that are getting movement in early postpartum are less likely to have depression, anxiety, psychosis postpartum.
Yep.
And so healthy mom is healthy baby.
Yep.
And it allows you to show up. And so if I can just like implore or like get a little bit of a crack in the guilt of I am working all the time and now I also want to do this exercise thing. I can't do that. Like that's very selfish of me. It's not, because you're going to be a mom for a long time.
Yep.
And the healthier you are, like, and as they get older, like now both my kids are in the gym with us.
Yeah.
And they know how to do push-ups and they do burpees and they like say moving my body makes my body feel good.
And
like
that's your family culture.
It's just family culture. And so they see that you prioritize moving for your body to feel good. And, our conversations are never around body shape and size. Like that's just our lean. It's around like, I feel good within my body when I move. And I think that makes me healthier and it makes me show up better as a parent.
Yeah. No, that's huge. And I think that's a big societal shift that's I'm seeing more and more of, which is really kind of cool to see.
Yeah.
All right. Someone, let's go postpartum, menopause, whatever you want. Like who's got your attention right now?
Yeah. So in terms of researchers, you've had a lot of these people on the podcast. So Rita Deering, Shefali Christopher, and Margie Davenport is my postdoctoral supervisor. They are wonderful.
Yes.
In the menopause space, I'm following a lot of the docs like Mary Claire and Rachel Rubin to really start helping to advocate in that space. And then Alyssa Olenek did work around menstrual cycle. And then her postdoc was in menopause. And so she has a very nuanced approach around the hybrid athlete across the lifespan.
Oh, cool.
And her research was on like physiology and metabolism in different phases. So
very cool.
She is another researcher that I really respect and I see a lot of benefit. She's got a big platform and she always goes with the nuance. And so,
love it.
Yeah, she's
fangirling already.
Really wonderful, and she would be another one that I would be
That's
looking
cool.
out for. She's not in the postpartum space, but more general fitness and menopause.
I feel like it's all going to kind of float into each other. Dr. Rubin, actually, she was a resident at Georgetown, and while I was there, so she came in and hung out with me in clinic, which is really cool to see kind of her mass explosion. And we're lucky enough to have her locally here, but she outspoken isn't the word, but I love it. The advocacy and like, we're just going to talk about this stuff and you're all going to have to listen. So, all right, last one for you. What does it mean to be an active mom?
To be able to get up and off the floor at 100. I want to be a Gigi. I don't want to be grandma. I want to be great grandma. So that's setting up the stones, right? Like the two fountains of longevity are estrogen and muscle mass. And so I'm going to try and hold on to.
I love that.
For as long as
all right. Well, I might not. I mean, I'm probably going to be dead by the time you get there, but you will be alive when I turn 100. So let's make a deal now. Okay.
Yeah. Get up and off the floor at 100.
Exactly. We'll do it together. All right. If you want to learn more about Dr. Christina Prevett and her work and her half marathon endeavors,
learn from my mistakes. I'm not perfect. You're not going to get perfect from me on my social media platforms. That's
exactly. For sure. Oh my goodness. And little birdie says that 2025 is going to be a big year for a lot of publications. Knock on wood. So definitely keep an eye on her Instagram because she posts good stuff here and then over on the Barbell Mamas. Thank you as always. It's lovely to catch up, and we'll have to go for a run one of these times with some gels.
Yes, with some gels. That's right. We're going to do it.
All right. Thanks so much. If you're navigating pregnancy, postpartum, or perimenopause, whether personally or professionally, check out all our free resources and upcoming courses at carriepagliano.com. This podcast reflects the opinions of Dr. Carrie Pagliano and her guests, and it is for entertainment purposes only and should not be considered medical advice. Always consult your healthcare provider with any medical questions. If you enjoyed the episode, please take a moment to leave us a 5-star review on your favorite podcast platform. And thanks for listening.